X-rays coming, you will see a lot of dark things over here, all dark. See? Sometimes you will see white, all white, maybe because the exposure was not good. So you'll see the exposure, you'll see the alignment of the patient. Patient's portable or sitting down or sitting, sitting up. Is he well prepared? Full inspiration or not? Okay, you will see this diaphragm, whether it's flat or doomed. Okay, if the patient has a lot of inspiration, this will be flat. That will be doomed like this. Okay, so ideally the X-ray should be taken with deep inspiration as sitting, but because you have here more sick patients, that's why we'll do portables. Okay, portable is not you will find the heart more than larger than it's usually is. If you read this way a patient X-ray while sitting, you will see the heart smaller. Okay, but when he's lying, you will see the heart big. You'll oh, this is cardiomegaly. This is not cardiomegaly. This is because of the patient aligned. Okay, patient presentation. Now, just to make it short, okay, a lot of things to comment. To make it short, you will see the soft tissues, you will see the bones, even the ribs. You will see here. This is one. This is rib one. This is rib two. Maybe you will make it dark a little bit to see the ribs. Okay, so count this one. 1, 2, 3, 4, 5, 6. Okay, six ribs is good. More than 8 ribs, this is hyperinflation. Okay, then you will see the trachea. This is central or deviated. Sometimes you will see trachea in the center, which is good. Okay, usually tilted toward the right side. This is normal. To see trachea a little bit toward the right side, this is normal, which is in this patient. But if you see more deviation toward the right side, then this means there's a problem. Or deviated to the left side, this also means there's a big problem. Okay, so you will see air inside this trachea. Okay, then after that you will see the lung parenchyma here, the lungs. Okay, if you see any opacity, any white material, that means there is pneumonia, or is it infection, or maybe sometimes blood. Okay, you will see. So you'll see the borders. You will see here the costophrenic. They call it here costophrenic angle. Costo means ribs. Phrenic means the diaphragm. So costophrenic angle. There's angle here. Should be angular, triangle here. If you see this is a sharp edge, that means there is no fluid here. If there is obliteration, there is a white thing in the edge here. That means there is fluid accumulated. Imagine you put some fluid inside the balloon. Okay, it will go down. Okay, so it will be in the deepest area, which is here. So you look for fluid over here. So this is good costophrenic angle. This one is good costophrenic angle. Then you will see the cardiac shadow here. If you can clearly see this one, the cardiac shadow, cardiac edge here and there, that means it is nice. Okay. If you cannot differentiate the edge, cannot see good continuous line, this is a problem. Even over here, if you see continuous line, you can see the dome. You can see, is it flat, is it rounded? Okay, you can see the whole area here. That means there's no pneumonia, so it's good from the basement of the lungs. Then you will comment on the cardiac shadow. Okay, you comment on cardiac shadow. Cardiac shadow, cardiac size. Okay, it should be less than 50% of the total. Calculate from here to here, and from here to here, from the last point here and the last point here, from the midline. Okay, you will see this. Is it 50% or more of the chest? That means there is cardiomegaly. Of course, you cannot comment on this because this is portable. You have to have the standing X-ray. Okay, and I think this is the thing. You'll see they do under the dome. Maybe part of the abdomen is there. Maybe you'll see here some air, which is from the stomach. Air under diaphragm, to the stomach sometimes, or if the air is leaking from the stool, from the bowel, it will be accumulated here. You will see this diaphragm only one line, then there is black area. So this means some surgical problem. So this is why short information. You will go for this one. This is for the same patient. Now you can see that the doom even more higher, right? That means the patient is not putting inspiration effort. They did it without inspiration. So the lung is short, right? Shorter lung. And there is, you cannot differentiate the border, right? Here, some fluffy area over the border. So it's not continuous line here. It's not continuous line here. You cannot see the line, right? That means there's pneumonia over here and pneumonia over here. See some whitish material over here. So this is pneumonia. This is pneumonia. That's it. Are you recording?
Yeah.
Really?
So if pneumothorax, what we will see?
Yeah, pneumothorax is different. Pneumothorax you will see. Let's see another patient. Pneumothorax, you will see more black area over here.
Black.
Black, more black. Pneumothorax means there's air inside the lung, right? More air inside the lung. So you will see more black area, mainly in the apex here and in the border, lighter border here and here. You will see more black material coming out. So if you see more black, that means either the patient is having pneumothorax, or there is more exposure of the lights, or maybe the patient has emphysema. COPD. COPD patients, you will see hyperinflation. You will see the flat diaphragm. You will see it, if you count the ribs, you will see it more than 8. Here's 1, 2, 3, 4, 5, 6. If you see it more than 8, that means the chest is hyperinflated. This is emphysema. This is COPD, chronic obstructive pulmonary disease. This is
Fluid.
if a fluid, usually you will see it deep here in this angle.
So black also.
No, you will see it white because fluid is white. Okay, so if you see this area like this and you see only like this, there is no angle, no sharp angle. That means the fluid is accumulating here down. So this is pleural effusion. They say pleural effusion.
Hemothorax.
Hemothorax will be the same as pleural effusion usually. Yeah, the fluid, blood or fluid is always the same. Yes.
Lung collapse.
Patient want to talk to you.
Really?
Because
Okay.
15 minutes
We're waiting for the result. That one.
Lung collapse, usually you will see a shadow. You see the lung is mainly accumulating on this side, pulled by this trachea toward here. The lung collapse will be here, so you'll see the small line over here. Okay, and this one has no tissue, only here. Okay, and see you'll see the trachea deviated toward the side. Okay, toward the collapse side. If the collapse is here, you'll see the trachea deviated to here. If the collapse is here, you'll see the.
But most of the time, right side ang lung collapse.
Depende.
Depende, it's not.
Depend on the tracheal. If this one sometimes by this one, no?
Usually-
If intubated
If
mo.
tracheal deviation, they will